Good day to our academic head and thesis advisor, Ms. Angeline T. Salonga, to our respective panelists, Mr. Marlex Lee Sanchez, Ms. Jerry Bonito, and Ms. Jonah Alusado. I am Bayhayria Sulaiman. I want to greet every one of you a pleasant day. Together with my teammates, Ms. Bernalyn Mateo, Ms. Maricar Apolonio, and Ms. Shermaine Pagayaw, we will present our research study entitled Challenges Faced by Healthcare Professionals Caring for Pregnant Women and Their Neonates during COVID-19 pandemic. So now, I will offer you with the background of this study. As the coronavirus disease spread globally, care providers are grappling with the impact of pregnant women, potential and maternal and infant outcomes from coronavirus 2019 and COVID, infecting pregnant women, lessons from SARS, MERS, and other human coronavirus infections viruses. These previous experiences with coronavirus infections in pregnancy indicates that these agents are capable of causing adverse clinical outcome including life-threatening maternal disease that in some cases required hospitalization, intensive care, and ventilatory support. Both of these coronaviruses can result in maternal death in a small but significant number of cases. But the significant risk factor for the fatal outcome during pregnancy have not been clarified. The objectives are to provide guidance on how to properly screen and test pregnant patients for COVID-19 prior to and during admission to labor and delivery, to reduce the risk of maternal and neonatal COVID-19 diseases by minimizing hospital contact and appropriate isolation, and to provide specific guidance on how to manage COVID-19 positive women as well as the critical ill COVID-19 patient during labor and delivery. Maternal and prenatal outcome related to COVID-19 and pregnancy. The systematic review summarizes the available global data on the effect of COVID-19 pandemic on maternal and prenatal outcome. We found increased maternal mortality and stillbirth, maternal stress, and rupture ectopic pregnancies during the pandemic compared with before the pandemic. Social distancing measured the deferral of non-essential surgery, and fundamental modification in the way primary and secondary care services were delivered were all implemented in the hospital. Many antenatal contacts took place digitally in maternity care. Birthing partners' presence was restricted, and doctors were required to utilize proper personal protective equipment as needed. The lacking of medical facilities, staff shortages, and the unpredictable character of the disease, as well as the extensive virus transmission, was discovered to have serious effect to the health system. Many circumstances happen like pregnancy and birthing care have changed dramatically, and we as a midwife should adopt the practices, having a proper precaution to prevent the virus from spreading. Those are the challenges faced by midwives for caring those pregnant women and neonates during this pandemic. As we choose this study to determine the challenges faced by healthcare professionals caring for pregnant women and their neonates during COVID-19 pandemic. As a result, the care provided for pregnant women and infants has also changed. It is expected that the virus will continue to affect the lives of maternal health care and also the midwives. So now I will call on Ms. Shermaine Pagayaw to discuss the significance of the study.
Thank you, Ms. Bayharia, for the background. Now I will discuss the significance of the study. The importance of this study is to know the challenges faced by the healthcare professionals, especially for midwives, to be open what is the reality facing the midwives throughout pandemic. This study is extremely important for the field of midwifery. It will help improve the knowledge and skills of the individuals involved in providing care during the COVID-19 pandemic. During the pandemic, many of them experienced depression, anxiety, and physically and emotionally draining work. The study revealed how midwives handled the responsibilities of providing care during this time. The coronavirus infection and the psychological stress it caused lead to an increase in job obstacle. It also lead to a personal sense of failure. It is significant to build confidence to handle situation properly. professionalism, precautionary measure to prevent the spreading of the virus, and to help pregnant women to the best of midwives' ability to bring birthing care as good despite of this pandemic. The one who benefit for this are those midwives, healthcare professionals, and pregnant women with their neonates. For the statement of the problem, here is Miss Bernadine.
Thank you, Mr. Mina Paglayaw. Good morning, everyone. My name is Bernardine Cunanan Mateo, fourth year student of Bachelor of Science of Midwifery. Now, I will discuss how we formulate our statement of the problem. We formulate our statement of the problem. First, we discuss the current issue, and then we formulate the title, which is the challenges faced by the healthcare professional caring for pregnant women and their neonates during COVID-19 pandemic. We choose this study because it's a work-related issue. As a midwife handling patient in maternal and childcare during pandemic is not easy. There's a lot of challenges and problem during pandemic. Now, after that, we formulate our statement of the problem. By the way, the statement of the problem is divided into two parts: the general problem and the specific problem. Under general problem, we use this: what are the challenges and strategies faced by the healthcare provider in maternal and childcare during COVID-19 pandemic? Then, after that, we formulate specific problem, which is what are the impact brought by the COVID-19 pandemic toward your delivery care to your patient? Next, how do you cope up with the current situation, which is pandemic? And then, COVID-19 has changed the way healthcare is practiced. How has this affect your work style? And as a healthcare professional, what learning experience have you gained from this pandemic? And lastly, what strategies in dealing stress during pandemic? This specific problem formulated to help answer the general problem and the main issues. Now, we go on conceptual framework. Our study used this PDSA Deming wheel. PDS means plan, do, study, and act. Concept by Mr. Edward Deming, PDSA. Model was used to achieve the objectives of the study. It is the process-oriented learning frameworks that help individuals to improve their skills and knowledge. Under the plan, we assess the current situation, then we identify the possible respondent, then plan for collecting data, and we do the plan dissemination. Under the do, we carry out our plan by giving survey questionnaire through email and data collection. Under this study, we analyze by summarizing, categorizing, and interpreting data. And lastly, under the act, we identify the problem and we develop action plan. That's all. Thank you. Next, Ms. Maricar Apolinario will discuss the research methodology.
Thank you, Ms. Bernardine, for the statement of the problem. My name is Maricar. I will be discussing to you the research methodology. A research methodology, this study uses a qualitative research method with a descriptive and phenomenological research design. It is uses the experiences shared by midwife, staff based on question and answer. An open-ended questionnaire was sent through their email with a week turnaround response time. Further in-depth interviews were conducted whereas participants shared their personal experiences in maternal and childcare during COVID-19 pandemic. This technique helped the researcher to have a wider view that what are the challenges and strategies faced by the healthcare providers in maternal and child care during COVID-19 pandemic. This research, we use the qualitative research, which means it is used for an open-ended questionnaire. By analyzing summarizing, categorizing, interpreting data, non-numerical data analysis, and more on explanatory and narrative. We use also in this research a descriptive method. This is a type of research that is used to describe the characteristic of population. And this research does not answer questions about why a certain phenomenon occurs or what the causes. Phenomenological means it is a form of qualitative research that focuses on the study an individual based on life experiences within the world. So the researchers use descriptive and phenomenological method in this study wherein experiences of the participant who answered an open-ended questionnaire that was sent through our email were taken into account. Followed-up interviews were then conducted to further elicit their personal experiences towards maternal and childcare during the COVID-19 pandemic. These all techniques were helpful to the researcher in identifying the challenges that the participant face as well as the strategy they implement to be able to deliver a quality maternal and childcare despite the said pandemic. And then I will give you the participant and sampling method design. This design study included the 12 staff midwives from tertiary hospital base, are registered midwives involved in the care of a pregnant woman and child care during the COVID-19 pandemic. The participants were selected based on their experience and expertise in handling the patient with COVID-19. In this case, researchers used purposive sampling method. In purposive sampling method, this is a technique to recruit participants who can provide in-depth and detailed information about the phenomenon under investigation. The target participants were the registered midwife working in a tertiary level hospital from 4 different institutions who were directly involved in maternal and child care. Purposive sampling method was used in this research, whereas 12 members from institution based on their expertise and experience in handling maternal and child care during COVID-19 pandemic. They have completed the questionnaire sent through our email within a week period of a data collection. So that's all. Thank you so much. May I call on Miss Bayharia to give you the closing remark.
Thank you, Miss Maricar and the rest of the team. Again, we are the fourth year level Bachelor of Science of Midwifery of a College of Our Lady of Mount Carmel, Pampanga, and we are humbly thank you for listening on our virtual presentation entitled Challenges Faced by Healthcare Professionals Caring for Pregnant Women and Their Neonates During COVID-19 Pandemic. And the room now is open for any question, suggestion, and recommendation. That will be all. Thank you.